He joins us now. Governor, welcome. Thank you for being here. What's your big idea?
It takes a village, as they say, right? And so it's everything from the wraparound services that you need. You hit it right on the head when you talked about this isn't a city problem. So you don't just have to have the treatment centers and recovery and the programs in the cities. You need rural access to care. And so when we came in, as you mentioned, New Hampshire is really at the tip of the spear, especially in fentanyl and overdose deaths. You know, well over 400 a year in our very small state. We had one of the highest rates of fentanyl deaths. So we knew we had to kind of whiteboard this out. And what you still see is there's still a lot of states out there and a lot of areas that are still doing treatment and recovery the way they used to do it. Okay. Same nonprofits in the same city centers, and that's all they're kind of doing. You got to break that mold. And so the wraparound services we talk about is, for me, it was recovery-friendly workplaces. Now, why? Well, I ran a business in a very rural area. I had hundreds of employees, and when they were dealing with addiction, it was, well, are we just going to fire them? We can't have that here? Or are we going to help them get on a better path? I called it sending them back to the wolves. If you just have an employee, they come in, they're dealing with an addiction issue, you just fire them, guess what? They're going back to exactly where they lived, without a job, depressed, no self-worth.
So how does it work? What do you do?
What we do is very simply, we don't have a massive government program. We simply go out, and for workplaces that want to help their own employees, we train them in terms of what resources are out there. Where are the treatment centers? Where are the recovery programs? How do you do peer-to-peer support programs? And we just train basically their HR departments and their senior staff. When someone comes to you, this is how you address it. And guess what happens? They can retain that worker, because hiring and retraining a new worker is painful. They get to give that worker a kind of second chance, an opportunity. It's a win-win. And so by doing that and driving this rural access with the workplaces, you know, self-worth is such a big part of recovery, of breaking that stigma of addiction. People want jobs. They want to take care of their families. You tell someone that lives up in the mountains, yeah, you want treatment and recovery, drive 200 miles into the inner city, and they'll take care of it. They're not going. They're going to, we call it toughing it out. Yeah. You know, they can be functional addicts, if you will, which is a terrible place to be. So bring the treatment to them. You do that, they're going to grab onto it.
How does that work? How do you get the treatment to them without spending money you don't have?
So you spend the money, but so we have a lot of nonprofits that will run our recovery centers and treatment centers. And what we said is you can't have the same type of programs you had for crack cocaine or for marijuana or for alcohol. Alcoholism detox is very different than fentanyl detox, and that's a big issue. You need whole new centers. So we'll give you the grants, we'll give you the programs, but you have to guarantee us you're going to put a recovery program in a rural area. That created the doorway. So after recovery-friendly workplaces, I came up with the idea of this doorway program, which said, okay, 10 different locations all across the state. I actually sat, it was a Sunday night. This is an interesting story. I personally sat on Google Maps and kept putting pins in New Hampshire till I got it down to about a pin that was never more than about 45 minutes away from anyone in the state. Because I figured that's about as much driving as you can ask someone to do, you know,
on a regular basis,
right, to stay with their program. And I got it down, and I was able to match it up with some hospitals, got hospitals to partner. Because what we also found was, let's say someone overdosed. They'd go into the emergency room, they'd overdose, maybe they got naloxone, they'd kind of dry out. The next morning, the hospital would say, hey, you should really get in a recovery program. Goodbye and good luck. No. Doorways, our doorway program provides that warm handoff. So the hospital says, hey, you need to get in a recovery program, and it's that door literally right there. And they'd walk them down the hall.
In the hospital?
In the hospital, connected to the hospitals, which was an amazing opportunity. And so they literally warm handoffs, get them in the moment when they know they need help. Don't send them back and hope they make the best decision just for themselves down the road. Grab them, get them in the program, and give them that whole wraparound service in their community where it can really make a difference.
And you did overdose reversal. You put boxes around the state.
Yeah, we're the first state to make sure these naloxone boxes were everywhere. So, you know, if somebody did overdose, we want to make sure anybody, anywhere has access. It's such a simple thing to provide naloxone to reverse the overdoses and save that life. And then when you have the community supports right there on target, the firefighters show up, or maybe the police shows up, they come with recovery specialists, or there's literally a recovery specialist right there attached to the hospital next door. It's that warm handoff in that moment, so you're not losing them as part of the system.
Okay, but there must have been people who thought this is too permissive, this is being soft on drugs, this is not taking, and there must have been skeptical employers. What did you face when you started to try to change the approach?
If anything, I faced probably a little bit of pushback from the nonprofit community. Hey, let's not do it differently. differently.
Yeah.
You know, just give us our grant money. We know what we're doing. No, it's not that they didn't know what they were doing. They weren't forced into doing it differently. And as I'm an engineer by trade, so you have to sometimes whiteboard things out, get to the heart of the problem, and that rural access to care, the wraparound service piece. I created the recovery-friendly workplace piece kind of when I was running my own business up in the mountain, and I would just say, look, just because you're dealing with drugs doesn't mean we're going to fire you. And guess what happened? They all started coming in.
Yeah.
Hey, Chris, I got a problem.
Yeah.
Okay, let me get you help.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.